Hey everyone, it's Teepa. And this morning I'm going to go over a challenging situation. A woman is caring for her husband and is trying to support him. He has a long history of addiction issues, alcohol management issues, and also drug management issues. And now he's starting to develop a dementia. When that's happening, he's self-medicating at a higher rate. And when he does that, his ability to think and participate and engage, initiate is deteriorating pretty rapidly. So she's really in a quandary. She tries to help him, and yet he appears to be somewhat pretty much unaware that what he's doing is self-harming. So when he overuses alcohol and drugs, he has more brain change. And it's making him have even more problem with reality, with a day-to-day function, with how to get through a day. And she's really struggling because what should she do? What can she do? So step number one, she's proposed that maybe it's time to talk to his physician about what she's seeing and what she's experiencing. Um, and she's wondering, could this be some Lewy body that he's trying to self-medicate? And I would say, well, that's certainly possible. I'm also wondering whether or not some of his history might play a role. Um, he has, due to this behavior over a lifetime, had trouble. He's lost colon function. So he actually, I assume, has a colostomy. He's had prostate cancer, a heart attack, Hep C. And what she's really concerned about is this is going downhill rapidly, and she feels helpless. And I suspect to some degree hopeless. So she's wondering, should I get up with the doctor? Could this possibly be Lewy body or related to a Lewy body phenomena? And I'd say, well, let's pause. Let's take a deep breath here and go, so we have a long-term condition that's resulted in many phenomena that actually impact how your body and how your brain work together. And at this point, there's evidence that this long-term problem with trying to manage life through the use of drug and alcohol support has resulted in brain damage, and it's continuing on. It's not mitigated, it's not controlled. And so this is a very difficult combination to try to find support for. I will say that there are very few locations that will and are able to provide support for this complex situation. So I guess a few questions before we could move forward would need to be considered. Number one, does her husband have awareness that his brain is changing? Is he aware that he's having more difficulty than he used to have? Or does he seem totally unaware of that? Is the alcohol and drug use totally incapacitating him or simply making it harder for him to appreciate and understand the world around him, and making it more difficult for people, stakeholders around him, to try to give him any kind of support that he would accept? Is he in a situation where he is at risk for losing income, housing? How old or what kind of support structures are already in place? How does he access and get the medication and the drugs and the alcohol that he's using? Is there a system set up to try to help that be maybe less readily accessible? But then without alternatives, it's highly unlikely that a program would succeed. So what we're talking about is trying to manage the primitive brain's need and a belief that the only thing that keeps you alive and makes you feel safe is this supportive alcohol, which actually both sort of gives you energy, but also depresses the system. It robs you of awareness of what you're doing to yourself or to others by desensitizing you. And at the same time, it takes away the pain. It sort of anesthetizes you in another way. The drugs might be to, again, elevate or to depress or to at least make the pain tolerable. Because often people in these situations are trying to avoid pain. They don't like being uncomfortable. They're having difficulty with intake and output, and they don't know what to do to manage energy in a healthy way. So I'm worried about the helper as much as I'm worried about the person who's living with the dementia, because this constant state of distress isn't helpful for anyone. So maybe getting together and talking about this first. Like, what are the things that make you think Lewy body? What are the things that you think escalate or elevate this need for medication and drugs? What's the relationship that you now have with the person? Is it adversarial, or are you in support, or are you yourself finding that you're having more brain problems thinking things through, just trying to work on this because it is taking a lot of your life. Um, and who's involved beside you? Do the medical providers have an awareness of the dementia and the brain change that you're noticing? Or are they simply still identifying the long-term problems and the medical problems that the person has and has had for quite some time? So I'm not saying that I think it's a bad idea to talk to the medical providers. I'm just thinking perhaps before talking to the medical providers, it might be helpful to have worked through some pieces and thoughts and ideas before you get there. All right. So, for those of you out there who are simply dealing with dementia, all of a sudden it seems like, wow, whew, I didn't know I would ever feel lucky to just have dementia. And I'm not sure anyone would say that, but I would say that when you hear about more complex cases where there are lifelong patterns or long-term patterns involved, it certainly makes us more aware that each unique individual is going to have a unique experience of their dementia. And rarely, if ever, is the healthcare system at this point in time really tuned up and tuned in to the complex nature of adding dementia toward a later part of a lifetime when that lifetime has been fraught with issues. So, this may be a case where rather than us trying to talk about anything globally, as a care partner, getting a consult would be a first step, and figuring out what makes the most sense, not only for the person, but for me. How do I sustain a relationship, or can I sustain a relationship, or is this too painful? And I've got to step back because doing what I'm doing doesn't seem to be helping them. It's really hurting me. And that's an important thing to look in the mirror and realize sometimes I can't stop what's happening for them. Do I need to pause and take a look at what it's doing to me and make a determination of my next steps? And I'd say, for sure, you've done a great job raising your hand and saying out loud, I think I need help because I don't like where I'm at and I don't like what's happening. So, good work. Everyone out there, take care of yourself, take care with your care. And if you have a question, ask. I may not know the answer, but let's at least get it out in the open and start talking about it, because not talking rarely solves anything. Take care, all.